Hello, Don here. Welcome to Podiatry Practice Mastery. We're helping you get your practice to the $2 million mark and beyond. It's been a few days since I've run through my patients, and I find if I don't do them every day, it kind of builds up. So I'm going to go over the most valuable patients and the least valuable patients. I think this is going to help everyone the most because many patients or doctors are wanting to know kind of why they're not getting their practice to the $1 million mark. And I think some of the differentiators are certain patients are just worth a lot more and some are worth a lot less. So let me talk about that. So first was a 57-year-old female. She had a right hallux fracture and she was here for a 4-week follow-up. So this I consider a least valuable patient. Why? Because she did get the initial amount for the fracture code, but now she only gets the x-ray. So I try to limit my follow-ups for these. So they'll get the fracture code, they'll get the cam boot, and then at the follow-up, I tend to double book them in a 10-minute slot. So that's a way to be more profitable. Next patient, this was my first Lipazana. She had a really painful right first metatarsal head with really skin and bone. So 91, a lot of pain. We did a Lipazana for her. I took a video, so I took a video for this one as well. And she's doing well. We'll see. I'm going to see her back in 2 weeks. So Lipazana is probably worth 10 patients, right? So it's about $1,500 for the Lipazana, and it was easier than I thought. It's easier to explain, in my opinion, than the benefits of a $1,500 amnio injection. So it's better that way. Another patient was an MVP. Was a patient, that 52-year-old man that came in. He wanted, he's a dermatologist, and he really wanted laser. So he got bilateral Lunula, and he got my kit, which is the UV light shoe spray. And so the bilateral Lunula is about $1,500, and the kit's another $200. So that's another MVP patient. Okay. Next patient with MVP was bilateral plantar fasciitis with Equinus. So first visit, this patient got bilateral night splints, 1 foam roller in the morning stretch. So this is just showing the benefits of doing bilateral night splints. Okay, this is something that you certainly can do if they have bilateral Equinus or bilateral plantar fasciitis. Another patient, this is, I'm going to call it an interesting patient. So it came back 6 weeks after the 6 sessions of Shockwave, feeling much better, about 75% better. And I did a number 7 out of 6, meaning I did a bonus Shockwave, and I don't charge them for this. So this is something, when I do the 6 Shockwaves, I tend to sometimes, when they come back in 6 weeks, if they're still having some pain, I'll do an extra Shockwave and won't charge, okay? And I had a doctor ask me the other day, Don, why did you switch from 3 Shockwaves to 6 Shockwaves? I used to do 3. I used to do 3 for everyone, and then they went to PT. What I found is about week 5, during the PT, their foot pain got better, and the PT got all their credit. And I also like being present when they're starting to feel better by about week 5. So I find it works better. There's better patient compliance, and it's better for revenue for the office for doing 6 Shockwaves. Next patient, there was a fungal kit, so it's a nail sample follow-up, dispensed this patient's orthotics, and then they got a kit, which is the UV light shoe spray. And things like that. Other MVP patient was a patient had left metatarsal midfoot arthritis. So this is a good use of doing Shockwave. So we're doing 6 sessions of Shockwave, and we're doing an orthotic on the 3rd visit. So those were kind of MVP patients. A couple of other ones was a right plantar fasciitis pain and second med head pain. So I set up 6 Shockwaves, and because of her posterior tibial tendon dysfunction, the plan is afterwards we're going to set her up for a Ritchie brace or like an AFO. Another was my Lipazana number 2. Once again, I've done more Lipazanas than almost like my amnios. I don't do that many amnios. I'm finding Lipazana a lot easier to explain. This patient had a previous midfoot fusion, and he had a really a lack of fat pad to the heel region. And so we did Lipazana number 2, meaning that was the second Lipazana that I've done for this patient, and she'll be following up in 2 weeks. Another patient, 2 least valuable patients. One was a status post right first MPJ fusion. We only got an x-ray, and another least valuable patient was another patient that came back after a stress fracture. Okay, a couple of more most valuable patients. One was a patient that had bilateral balance braces. So this patient was really pleased. He had a kind of a steppage gait, and it really helped him. So this is his second pair of balance braces. So we got his other pair 5 years ago. Every 5 years you can do DME. So people have been asking me, how do you get like from a $500,000 to $1 million? DME is a big part of it. So every patient that has a fracture, foot pain, things like that, you can do a cam boot to start. Everyone that has Equinus, you're doing a night splint. And like custom like braces, AFOs, things like that, balance braces, these are things that really can provide a lot of revenue for the practice. Okay. Next patient was a patient with a bunion and hammer toe. They got orthotics. One way I've kind of been explaining for bunions is that I always say, number one, I want you to correct the shoes with an anatomic shoe. Second is I think an orthotic is second best. Why? Because you can put it in the shoe and not have to move it around. And I think correct toes, or like toe spacers, are third because you have to put them on every day and it's a little bit more complex. I always say shoes, then orthotics, and then the correct toe. So they can do correct toes and orthotics at the same time. Next was another patient that Lamis will follow with the kit. Once again, all these add like $200 to the practice to the patient visit. Next was plantar fasciitis number 2 visit. This patient, second visit, got number 1 out of 6, and the plan is to do orthotics on the third session. So the way I tend to do it is I do 6 sessions of Shockwave. When they, about session 3 is when I scan for orthotics, because then the foot plan will start coming down. Next MVP patient was a flexor tenotomy patient. This patient on the right foot had digits 3 and 4, and on the left had the 4th digit. So those three flexor tenotomies, and then I see them back usually in 3 weeks, and I get an x-ray at that time. So those are some kind of larger value patients and lower value patients, just so you can see kind of how my mindset works in terms of getting things to the $1 million mark and beyond. Once again, people have been sending me some good questions. That was a question that someone else asked me, why I switched from 3 to 6. So if you have other questions, shoot them out. This really helps me. Go to email me, don@podiatrypracticemastery.com. Once again, most all of these things you'll hear throughout the podcast. If you want to kind of streamline the process, I have something called the $1 million practice formula. It's right on that webpage as well. You can get that, and it just kind of goes through all these kind of high-level ideas. Okay, until next time, thanks.